Today I'll be talking about medicated children and the effects of Ritalin on children with ADHD. Attention deficit hyperactive disorder is distinguished by a continual pattern of inattention and/or hyperactivity impulsivity. It is the most prevalent neurobehavioral disorder occurring in 2 to 18% of children throughout the world. 50% of children with ADHD might persist to have ADHD all through adolescence and adulthood. The most common treatment is Ritalin. Ritalin is a Schedule II central nervous system stimulant and shares many of the pharmacological effects of amphetamine, methamphetamine, and cocaine. Approximately 85 to 90% of all prescriptions for Ritalin are written for young children and adolescents for ADHD. Although research studies on Ritalin indicates an improvement in ADHD symptoms for children, it also indicates adverse effects. In one study, 53% of the children experienced adverse side effects. Out of the 53%, 9.9% withdrew from the study due to severe adverse side effects. Another study indicated that there was no correlation between the dosage and improvement for disruptive classroom behavior and academic performance. Additionally, the results suggested that an increased dosage of Ritalin is linked with an increase in social isolation among children. Another study indicated that parents accepted the medication for their children when the parents themselves were experiencing heightened anxiety and stress due to their child's ADHD. They also accepted the medication when their children were experiencing severe ADHD symptoms. They did so without considering the accuracy of the diagnosis, the needs or wants of the children, the adverse side effects of the medication, and options of safer alternative treatments such as therapy. The parents were accepting the medication unaware of why they were doing so. The results suggested that once the parents were made aware, they were able to make a decision based on the benefit and safety of their child. Although humorous, this comic indicates the serious implications of stifling young children's imagination from medication. The U.S. Drug Enforcement Administration reports that Ritalin is more potent than cocaine and affects the brain in the same way as cocaine does. Between 1990 and 2000, 186 deaths were linked to Ritalin in the U.S. alone, which represent no more than 10 to 20% of the actual incidents since they were voluntarily reported. An estimated 2.5 million children and teens in the U.S. are currently on medication. Children and teens who take Ritalin are 5 times more likely of sudden death than children and teens who don't. The sudden deaths are reported at usual doses. Also, Ritalin should not be used in children under 6 years old, since safety and efficacy in this age group have not been established. Some side effects are loss of appetite, insomnia, nervousness, stomach aches, tics, hypersensitivity, irregular heartbeat, mental or mood changes, cardiac arrhythmia, psychosis, hallucinations, and death. The label of ADHD is assigned to the child exhibits such symptoms as not listening when spoken to, forgetful, fidgets, talks excessively, and so on, the typical behavior of a normal child. Parents of the children are generally told that it is a neurological disorder or chemical imbalance in the brain. Although the National Institute of Health consensus on ADHD states that they do not have an independent, valid test for ADHD, and there's no data to indicate that ADHD is due to brain malfunction. The U.S. Department of Education Office of Special Education and Rehabilitative Services stated a child could qualify for special education if he was determined to have ADHD. The Individuals with Disabilities Education Act provides schools with an additional $400 per year for each child in special education. This has backed up the alarming rise or increase in the labeling and medicating of children that has taken place in the last decade within our schools. Matthew Smith is one of the children that resulted in a death from Ritalin. Matthew Smith died at 14 years old, which the cause of death was determined to be from the long-term use of Ritalin. According to Dr. Dragovic, Matthew's heart showed clear signs of small vessel damage caused from the use of Ritalin in his autopsy. A full-grown man's heart weighs about 350 grams, and Matthew's heart weight was about 402 grams. It's important to note that Matthew did not have any pre-existing heart condition or defect. Also, Matthew's parents were not informed of any tests such as an EKG or echocardiogram, which could have detected the damage done to his heart. These tests are not considered standard in monitoring treatment of ADHD in children. Sadly, without the possibility of detection, death is inevitable.